Growing older is a gift, but it comes with hidden challenges most people never talk about, especially when it comes to personal hygiene. Doctors see it all, and when it comes to seniors, there are 7 common hygiene mistakes that are not only embarrassing, but could seriously affect your health. From the bathroom to the bedroom, these tiny slip-ups can lead to major consequences. Are you, or someone you love, making one of these hygiene mistakes right now? Stick around, because number 4 isn't just surprising, it's something even the healthiest seniors overlook every day. I'm here to help you stay clean, confident, and out of the doctor's office. Let's dive into the 7 personal hygiene mistakes elderly people make that doctors notice immediately. You won't believe what's on this list. Mistake number 1: neglecting oral hygiene, the silent threat to the heart and brain. Oral hygiene is often overlooked in seniors, particularly those dealing with mobility issues, arthritis, memory decline, or poor vision. Many assume that brushing once a day is sufficient, or skip brushing entirely due to forgetfulness or discomfort. But here's the truth: failing to properly clean the mouth can lead to much more than just bad breath or tooth decay. It can become a gateway to systemic disease. The American Dental Association warns that gum disease, or periodontitis, is significantly more common in individuals over 65, affecting nearly 70% of older adults. Doctors can often spot this right away during a checkup due to signs like inflamed gums, dry mouth, or a persistent coating on the tongue. The real danger: poor oral hygiene increases the risk of heart disease, stroke, diabetes, and even dementia. A 2021 study published in the Journal of the American Heart Association found that individuals with gum disease were 2 to 3 times more likely to suffer a heart attack. The reason lies in bacteria. When plaque builds up, it leads to chronic inflammation, which doesn't just stay in your mouth. These harmful microbes can travel through your bloodstream, attacking your cardiovascular system and even impacting your brain. For seniors already at risk, this adds a dangerous layer to an otherwise avoidable issue. Doctors notice poor oral hygiene in seniors almost immediately because of visible dental neglect, halitosis, bad breath, dry or cracked lips, and even signs of malnutrition due to chewing difficulty. The fix? Seniors should brush twice a day with fluoride toothpaste, use an antiseptic mouthwash, floss daily, and visit the dentist every 6 months. Caregivers can also play a critical role by reminding or assisting with brushing and flossing. For those with arthritis, using an electric toothbrush with a larger grip can make brushing much easier. The bottom line is this: cleaning your mouth isn't just about teeth, it's about protecting your heart and mind. Mistake number 2: not bathing frequently enough, the invisible infection magnet. Many elderly individuals reduce the frequency of bathing or showering due to a variety of reasons: reduced mobility, fear of slipping, lack of energy, or simply a lowered sense of smell. While skipping a shower occasionally isn't a big deal, going days or even weeks without washing the body is a dangerous mistake that doctors often notice immediately. What may feel like a minor comfort decision can actually turn into a breeding ground for harmful bacteria, yeast, and parasites on the skin, leading to infections, body odor, and skin breakdown. Doctors frequently encounter skin conditions in older patients that are directly related to infrequent bathing. These include fungal infections like candidiasis, especially in skin folds, seborrheic dermatitis, cellulitis, and even pressure ulcers in bedridden patients. According to the National Institute on Aging, skin becomes thinner and more fragile with age, which makes it more susceptible to bacteria, tears, and infections. Combine that with a weakened immune system, and even minor hygiene lapses can escalate quickly into emergency situations. Additionally, poor personal cleanliness can aggravate existing health problems like diabetes and eczema, further complicating care. When a doctor sees greasy skin, red rashes in skin folds, untrimmed nails, or unpleasant body odor, it's a red flag. These physical signs aren't just noticed, they're documented, because they often indicate that the patient may be struggling with basic self-care or may not be receiving adequate support at home. The fix involves creating a simple, non-intimidating hygiene schedule. Even bathing 2 to 3 times per week with proper drying and moisturizing can make a huge difference. Adding grab bars in the bathroom, using a shower chair, and installing non-slip mats can eliminate much of the fear surrounding bathing. And remember, this isn't about appearances. It's about health, dignity, and preventing life-threatening infections. Mistake number 3: wearing soiled clothes or underwear for days, the hidden cause of skin issues and UTIs. You might be shocked at how common it is for elderly individuals to wear the same undergarments or clothing for multiple days in a row, sometimes without realizing the consequences. For some, it's due to cognitive decline, depression, or simply a lack of physical ability to do laundry or change clothes independently. While it might not be immediately apparent to the individual, doctors can detect this mistake quickly because it often results in specific health complaints, especially skin irritation, fungal infections, and recurring urinary tract infections, UTIs. Dirty clothes, especially undergarments, accumulate sweat, dead skin, urine residue, and fecal bacteria, creating the perfect environment for pathogens to thrive. This is particularly problematic in women, who are more prone to UTIs as they age. According to a study published in Clinical Interventions in Aging, elderly women wearing unclean or synthetic underwear were at significantly higher risk of developing UTIs. In men, prolonged use of soiled briefs can lead to fungal groin infections or contact dermatitis. Doctors often spot this issue during physical exams by noting skin redness, rashes in the genital or thigh areas, or recurrent UTI symptoms like burning urination and confusion. The simple solution: maintain a rotating supply of clean, breathable cotton underwear and change clothes daily, even if the garments appear clean. Caregivers can assist by organizing clothes by day, using labeled drawers, or offering gentle reminders. Installing easy-to-use laundry machines or employing laundry support services can also make a world of difference. Most importantly, seniors need to understand that clean clothing is not a luxury, it's a necessity for avoiding skin and urological complications. If your doctor brings it up, it's not judgment, it's a warning sign worth taking seriously. Mistake number 4: ignoring toenail and foot care, the shocking overlooked danger that could lead to amputation. This is the most shocking mistake, and one that doctors say is often ignored until it's too late: foot and toenail neglect. You might be thinking, toenails? Really? But yes, this small part of your hygiene routine can have deadly consequences if left unchecked. Many seniors cannot see or reach their feet properly, which means toenails go untrimmed, fungal infections go unnoticed, and cuts or blisters may become infected. In diabetic seniors, this can quickly escalate into gangrene, sepsis, or the need for limb amputation. It's not an exaggeration, according to the American Diabetes Association. Over 60% of non-traumatic lower limb amputations occur in people with diabetes, and poor foot hygiene plays a massive role. Doctors spot this issue almost immediately: discolored, thickened toenails, foul foot odor, cracks between the toes, or visible signs of athlete's foot are huge red flags. Worse, an unnoticed foot ulcer could be developing beneath a callus. For doctors, foot inspections are a crucial part of geriatric checkups because the stakes are so high. Even non-diabetics can face dangers from neglecting foot care. Poor circulation, peripheral neuropathy, and brittle skin all make the elderly more vulnerable to foot problems. A fungal infection today could be a hospital visit tomorrow if it's not addressed. The solution lies in proactive, routine care. Feet should be washed and thoroughly dried every day, especially between the toes. Toenails should be trimmed regularly, straight across to avoid ingrown nails, and monitored for color or texture changes. Seniors who can't do it themselves should see a podiatrist every few months. Wearing breathable socks, proper fitting shoes, and avoiding barefoot walking, even at home, can prevent injuries. Diabetics should have their feet examined daily, either by themselves or with help. The shocking truth is this: what starts with an ignored toenail can end in an amputation. Foot care is not optional, it's vital. Mistake number 5: improper incontinence management, a silent crisis no one talks about. Incontinence is one of the most sensitive topics among elderly individuals, yet it's also one of the most critical areas where hygiene can make, or break, overall health. Whether it's urinary leakage, bowel incontinence, or both, many seniors feel too embarrassed to talk about it or don't even realize how frequently it's occurring. Unfortunately, this silence can have serious consequences. Doctors often detect improper incontinence hygiene during routine checkups when they see persistent rashes in the groin area, strong urine odors, or signs of skin breakdown. In fact, unmanaged incontinence can lead to a condition known as incontinence-associated dermatitis, IAD, which can cause painful inflammation, open sores, and even secondary infections like PSA. A 2022 study in the journal Advances in Skin Wound Care found that over 40% of nursing home residents with incontinence develop skin complications due to poor hygiene. When the skin is constantly exposed to moisture, bacteria, and enzymes from urine or feces, it loses its natural barrier function. For elderly people with limited mobility, this risk increases exponentially. Worse still, persistent wetness can promote fungal infections in skin folds and lead to a heightened risk of urinary tract infections, pressure ulcers, and systemic infections that require hospitalization. It's a silent crisis happening behind closed doors, and doctors are often the first to notice the signs. To prevent these complications, seniors must use proper incontinence products and change them regularly. Skin should be cleaned thoroughly with mild, pH-balanced cleansers, and dried completely before applying moisture barriers like zinc oxide creams. Breathable adult briefs, routine skin checks, and absorbent mattress pads can all reduce risk. If mobility is an issue, caregivers should establish a changing schedule and monitor skin condition daily. For anyone experiencing frequent leaks, consulting a urologist or pelvic floor specialist can help manage the root problem. There's no shame in using protection. It's not about weakness, it's about maintaining health and dignity. Doctors know it, and they hope you'll take it seriously before the damage becomes visible. Mistake number 6: not cleaning assistive devices properly. Eyeglasses, hearing aids, dentures, canes. Assistive devices are a lifeline for seniors, but when these devices aren't cleaned regularly, they become a hidden source of bacteria, fungi, and irritation. Think about how often glasses fog up, dentures collect food particles, or hearing aids sit in the ear canal for hours at a time. These devices touch sensitive areas of the body, eyes, ears, mouth, hands, and if they're not cleaned properly, they don't just stop working efficiently, they introduce infections and discomfort that doctors notice right away. For example, an unclean hearing aid can lead to ear infections and painful wax buildup. While poorly maintained dentures can cause oral thrush, sores, and digestive issues, doctors frequently spot this mistake during physical exams. Dirty or scratched eyeglasses affect vision and balance, increasing the risk of falls. Hearing aids covered in earwax or moisture cause muffled sound, which can be misinterpreted as cognitive decline. Dentures coated in bacteria or left in overnight lead to halitosis, inflammation of the gums, and mouth ulcers. According to the Journal of Gerontology, unclean dentures in elderly patients have been linked to aspiration pneumonia, when oral bacteria are inhaled into the lungs, often with deadly consequences. Even walking aids like canes and walkers, if never wiped down, can harbor viruses and bacteria that transfer to hands and then to the face or food. The good news is that cleaning these tools doesn't require much effort, it just requires consistency. Eyeglasses should be wiped daily with a microfiber cloth and cleaned weekly with soap and warm water. Hearing aids need daily drying and wax removal, and they should be stored in dehumidifying containers. Dentures should be brushed twice a day, soaked in a denture cleaner, and never worn to bed. Canes, walkers, and wheelchairs should be wiped weekly with disinfectant, especially the handles. Doctors can tell when these devices are neglected, and in many cases, the side effects are written all over the patient's body. Clean tools support a clean body, it's that simple. Mistake number 7: forgetting hand hygiene. Even at home, a small act with huge consequences. Hand hygiene might sound elementary, but in the elderly population, forgetting to wash hands regularly, especially after using the restroom or before eating, can have serious, sometimes fatal, consequences. Many seniors stop practicing regular hand hygiene because of reduced dexterity, cognitive decline, or simply a lack of awareness about its importance at home. Doctors often notice this mistake not just through observation, but by connecting it to recurring health complaints like stomach infections, colds, or even sepsis in extreme cases. A study from the Centers for Disease Control and Prevention, CDC, found that regular handwashing could prevent up to 30% of diarrhea-related illnesses and 20% of respiratory infections in older adults. Poor hand hygiene allows pathogens like E. coli, norovirus, and Clostridioides difficile, C. diff, to spread, either through contaminated food, surfaces, or direct contact. In elderly individuals with weakened immune systems, these pathogens can lead to severe dehydration, hospitalization, and in some cases, death. What's more, those who take medications that lower stomach acid or affect gut bacteria are at even higher risk, since their bodies aren't equipped to fight off bacterial invaders. During appointments, doctors can sometimes detect signs like fingernail grime, gastrointestinal complaints, or lingering respiratory symptoms, all pointing to unwashed hands as the silent culprit. Fixing this mistake is both simple and life-saving. Seniors should be encouraged to wash their hands with soap and warm water for at least 20 seconds, especially after using the toilet, before meals, after coughing or sneezing, and after touching pets or soiled clothing. Hand sanitizer can be a great alternative when soap and water aren't available, but it must contain at least 60% alcohol to be effective. Installing visual reminders in bathrooms or kitchens, like stickers or signs, can gently prompt routine hand hygiene. In assisted living environments, staff should model and promote these behaviors. Doctors can diagnose infections, but preventing them starts with a simple scrub, and it's one of the most powerful defenses an aging body can have.